Hello everybody, Dr. Dan here, and today I wanted to talk to you about natural cancer therapies or holistic cancer programs. Here at Peak Vitality, we actually have a complementary cancer support program because we're working with people who have been diagnosed with cancer or some type of malignancy, and they're either doing surgery, they're doing chemotherapy or radiation or a combination of those three, or they've gotten past that piece and they're wanting something additional to stack the odds in their favor. So what does a really good natural cancer program look like? So there's three key features. One, and let me say this as a caveat, we always recommend that people go through conventional care to some degree that fits, what their diagnosis is. But what we do here at Peak, the first step is we want to identify, what can we do to make their body more resilient? Because if you have any type of inflammation, underlying infections, disruptions in your gut, micronutrient deficiencies, or any metabolic issues such as blood sugar or insulin resistance, you actually can worsen your prognosis. So the first step is make the body as resilient as possible. We do that with advanced labs. We want to look at everything that's going on and actually get a full understanding of any type of roadblock that's getting in your way of your body working to the best of its ability, and for the resilience of also to be able to handle surgeries, chemotherapy, or radiation. So that's step one, make the body as resilient as possible. Step number two is we want to make the body as metabolically stressful to cancer as possible. So what do I mean by that? That sounds like a lot. One of the things that we do know is if there is oxidative stress or inflammation in the body, or if you're on a diet that may be high in certain sugars or simple sugars or carbohydrates, that tends to create an environment that helps cancer progress, especially certain types of cancer. I don't want to say all cancers, but there are certain types of malignancies that an environment that's rich in sugars or high blood sugar, insulin resistant, it does tend to lend itself to progressing that cancer forward. So we want to create stress on the cancer by eliminating anything on the inner environment that tends to feed that process, or at least makes it more difficult for the cancer while making your body function really well. And sometimes, you'll find that a ketogenic or a low carb diet really helps here. So definitely low glycemic foods, but metabolically, we want the body working as efficiently as possible. So that's number two, make the body as metabolically stressful to cancer as possible without any compromise to your own health. And number three is to actually look at some research and some testing that helps identify some weaknesses or some genetic aspects or characteristics of the cancer so that we can exploit those individually. So we do a test that we send to Greece. It's a blood biopsy, so we just take a simple blood test. We send that to Greece, and they do something called circulating tumor cell testing, or CTC. And what that does is that helps us understand some of these different metabolic features of the cancer so that there's certain foods or nutraceuticals like supplements or herbs that can interfere with the metabolics of that cancer, and then also look at things that certain probiotics that have been shown to create an issue or even trigger or result in apoptosis or higher likelihood of apoptosis in those malignant cells. So that is what a good complementary cancer support program looks like. Three key features. Number one, make the body as resilient as possible. Two, make the inner environment metabolically stressful to cancer while supporting your own health. And number three, we get some circulating tumor cell testing so we can identify particular genetics that we can interfere with naturally on the cancer itself. All this while doing things like your conventional care, your surgery, your radiation, and your chemotherapy. And we do work with people's oncologists to support that care and not interfere with it so that you get the best of both worlds. Hope that helps. Have a wonderful day.